Good evening, everyone. My name is Jasmine Shah. I'm the Head of Advice and Support Services and the Medication Safety Officer here at the NPA. Just wanted to say a warm welcome to everyone and thank you for joining me for our second flu webinar of the season to cover the actual delivery of the NHS flu vaccination service in England. In terms of what we will cover today, we just wanted to touch upon the general and key considerations for service delivery in practice this season, in particular during the COVID-19 pandemic. I also wanted to cover the key changes to the NHS flu vaccination service this year in England, what support and resources we have available to help you in many different ways to make sure you have a very successful flu vaccination service season, and also address a number of questions that we are receiving through our advice and support service line in relation to the flu service this year. And I just wanted to cover off some of the key questions arising from it, which seems to be puzzling a lot of members today. So thank you, and we shall start. So when we think about delivering the flu vaccination service this year in particular, and this is again going back a few weeks now, if not more than a couple of months, obviously the number one consideration that was at the forefront of everyone's mind is how to deliver this service safely in a COVID-secure way during the pandemic. And I'm sure that this was the same question that came to mind with many of you when you were first thinking about starting to prepare to deliver this service. Excuse me. And we covered a number of the preparation manners in our first flu webinar. So the key factors here are how to ensure patient and staff safety when delivering this service. Looking at the risk factors, how to do risk management, taking into consideration the PPE, how to screen patients, infection control, cleaning, hygiene procedures, also where to actually provide the service. Use of consultation rooms was a big question mark with many members, and also what sort of resources would be available from the NPA, what would be the training requirements, and indeed how to deliver the service, because in previous years, many members have relied on walk-in patients to deliver it, where the considerations this time were the amount of time it would take in between each patient and the hygiene and the cleaning procedures in between to ensure, minimize the risk of infection from COVID in particular. Vaccine availability was also a key consideration. And we have had a number of questions about the funding for it and the cost of the service and many others indeed. So we will cover a number of the key considerations throughout this webinar as we go along. Having sort of putting together the slides for today's webinar and realizing just the scale of how much information there is at the moment that needs to be covered, I would like to say from the outset that we will not be able to cover every single element of this service today. We will endeavor to cover the majority of the key elements, and we will potentially be looking to put on a further flu webinar in a few weeks' time to cover some of the other elements. So, of course, as you know, the flu vaccination service in England under the NHS runs from 1st of September to the 31st of March next year. The PGD, the National Flu PGD, and the service specification that goes with it have been published now. They were published on the 28th of August. They're available to download from the NHS England website. And the PGD is available both in PDF and Word format. Furthermore, to provide the legal basis for service provision, the Pharmaceutical Services Advanced and Enhanced Services Directions have also now been amended and published, and they're available to view on the NHS BSA website. So the legal document to provide the flu service and the enabling directions are all in place now. Now, you will obviously have seen this already in the service specification for the flu service, but I would just like to highlight the key changes again. And the number one question was, do we need written consent? And one of the first key changes is that there is no mandatory requirement to obtain written consent for this year's flu service. However, verbal consent is a mandatory requirement and must be obtained and recorded, and we'll talk about that a little bit more in the FAQ section. There is an expansion of the cohort of eligible patients, which is listed in the inclusion criteria for this PGD, and we'll discuss that in a little bit more detail. Furthermore, to make things easier for delivery in the community pharmacy, there is no requirement now to notify your NHS England regional team prior to undertaking any vaccinations off-site of your pharmacy premises. Similarly, there is no requirement to notify a patient's GP in advance if we are vaccinating a patient in their own home or in a care home. And patients can be vaccinated off-site, including being able to vaccinate the care home staff this year as well, alongside care home patients within the care home itself. And furthermore, historically, the flu service, vaccination service, as well as other advanced services and a number of other pharmaceutical services, always needed to have been delivered in the consultation room in the pharmacy. This year, with a view to managing COVID infection, flexibility has been introduced to enable community pharmacists to vaccinate patients within the pharmacy in an appropriate space outside of the consultation room, if that is what is appropriate to the pharmacy premises and the processes you put in place. However, this does not mean that the requirement to have a consultation room has been removed. It remains in force. And this is really important because to avoid any confusion, I just want to clarify, if your pharmacy does not have a consultation room, you cannot provide this service, because the requirement to have a consultation room in the pharmacy premises before you can provide the service remains in place. Furthermore, if a patient actually requests that they would like to have their vaccine administered in the consultation room, then they must still be able to have their vaccination administered in the consultation room if they request it. So that is really, really important to understand. And I'm laboring this point because it seems to have caused a little bit of a confusion. So I hope that clarifies the requirement to have a consultation room. Moving on, the NHS Flu PGD also lists the key requirements for pharmacists to be able to actually work this PGD and to operate this PGD in practice. So pharmacists have to be GPHC registered, and they must be authorized by name under the PGD before they work to it. And this authorization comes by completing Section 7 of the PGD. This must be done before the PGD service can be implemented by that named pharmacist. Of course, as always, there is the requirement to have undertaken appropriate training, and there is more information on that in the service specification, and to complete the declaration of competence, as well as to make sure that they're trained in line with the national minimum standards and core curriculum for immunization training. So in our first webinar, we covered the training requirements in detail. So for reference, if you missed that first webinar, it is still available to download and view. And my lovely colleague Simon, who's providing the technical support this evening, is going to be loading up this webinar on the website as well. Thank you. Furthermore, another requirement is that all pharmacists must be competent in the use of PGDs, and there is a nice competency framework which is available from the from NICE to support healthcare professionals in using PGDs. All pharmacists must be familiar with the vaccine products, which means that you need to be familiar with the actual information in the SPCs for the vaccine products themselves, which cover a number of key elements about the vaccines, including excipients and licensed use, age groups, etc. And be up to speed with the information in the Green Book on vaccines. Pharmacists need to also be competent to actually undertake the immunization process, as well as to discuss issues related to seasonal flu immunization with patients. And this comes from the training that they receive, whether it's face-to-face or online training. And there are flu information modules covered under that, which are also, the training is also available through the NPA. The competency also needs to cover the handling and storage of vaccines, including, very importantly, the management of cold chain. Excuse me. And I would like to highlight this because for the last few years, from my experience, certainly, we routinely get questions about inadvertently storing vaccines outside of the recommended temperatures, and also particularly when going off-site to vaccinate your patients in an off-site location, about the need to maintain cold chain, and it is important and relevant to those scenarios as well. If your vaccines have not been stored correctly within the right temperatures, they need to be managed according to vaccine incident guidance outlined by the PHE, and we'll talk about that a little bit more detail later. Of course, there is always a risk of anaphylaxis with any type of immunization that's administered, or vaccination, that's administered, and we will discuss that in a little bit more detail afterwards. And that management of anaphylaxis and basic life support training is a mandatory requirement for the vaccination training undertaken to provide the flu vaccination service. And very importantly, every single pharmacist who is planning on operating this PGD must have access to a copy of the PGD. They must have completed Section 7. They must have read and understood the PGD completely before operating it, as well as any associated online resources which are signposted from the PGD itself. And very importantly, the PGD can only be operated by the pharmacist authorized by name under the latest current NHS England and NHS improvement version of this PGD before working under its authority. Every year, the flu PGD is updated, and you must use the latest updated version which is relevant for the current flu season. And again, I'm laboring this point because I have received a query recently from a pharmacist where inadvertently the wrong PGD had been obtained, and it was last season's PGD. So please do double check that you are using the current version of the PGD from NHS England and NHS Improvement. If you operate last year's PGD, it is no longer valid, and you cannot make any. You cannot administer any vaccines under last year's PGD. So also important in the PGD is to be very familiar with the inclusion criteria. As I mentioned in the key changes earlier, the cohort of patients who are eligible to receive the flu vaccine under the NHS Advanced Service PGD has been expanded this year. Of course, with the COVID-19, one of the things is that there is a shielded patient list. So the point I want to make here is that you must check the shielded patient list that they're shielded at the time of vaccination. The reason I mention that is patients' shielded status can change as their condition changes. So that is quite important to note. On the left-hand column of my slide here under the inclusion criteria, it lists the age criteria for all people aged 65 years and over. And for those who are aged between 18 years to under 65 years, they would be eligible for the service if they fell in one of those clinical risk groups which are listed there. There is a full and complete and a more detailed list of clinical risk groups in Annex A of the service specification. So please do refer to that because it really expands and provides more detail on the clinical risk groups. On the right-hand column of my slide here, you can see the additional expanded cohort of patients who are also eligible. Please note, however, that the PGD does not permit vaccinating anyone aged less than 18 years. Anyone aged less than 18 years must be signposted to an alternative service provider, for example, their GP practice, for them to receive their flu vaccination under the NHS. Now, alongside with noting the inclusion criteria, which I realize I've just touched upon one part of the exclusion criteria there as well, it's very important to note the exclusion criteria in the PGD and what actions to take when a patient is not eligible. And one of the key exclusion criteria is where there is no valid consent received, the service cannot be provided. Similarly, a service cannot be provided to anyone who's aged less than 18 years of age, etc. And the other exclusion criteria are also listed there. Where patient is excluded, they do need to be referred appropriately to an alternative service provider to ensure that they don't miss out on receiving the flu vaccination this season. Again, the information is contained in the PGD and the service specification. So as a checklist, it's really important. Obviously, you will be providing the flu service, which is an advanced service. So it is not mandatory for you to provide this service as an NHS pharmacy contractor, and it's something that you can choose to do so. If you choose to do so, it is important that the criteria for providing this service is adhered to. And one of the key essential criterion is that the pharmacy must be providing all essential services as required under the NHS contract before they can provide this service. And the rest of it is made up of other things we've covered already, such as having undertaken appropriate training, ensuring that the pharmacy team are aware of the service and the eligible cohorts so they can help you to identify suitable patients and to offer the service to them. And very importantly, to ensure that there's relevant SOPs and procedures in place and there are the NPA resources available to support that. Very important to download and read through the full NHS flu PGD and service specification and to obviously share what's included in there with the pharmacy team as well, so they're also aware of that. Authorization, etc., needs to be all covered in that. So there are a number of NPA resources available to support our members specifically, and that is to provide vaccination services, and some of them are specific to the flu vaccination service. So we have a number of SOPs available, excuse me, as you can see, they're on the left-hand side, including some of the, not just the SOP for the National Flu Advanced Service for England, but other SOPs which are also required under this service, such as infection prevention and control. Administration of adrenaline is a useful SOP, which members have told us in the past that they find useful. However, please note that to administer adrenaline to save a life in an emergency, you don't need a SOP for that. Anyone can administer adrenaline in an emergency to save a life. But having a SOP in place is useful when you're providing a service because it also gives you information about how to draw up and administer adrenaline from an ampule as well as injecting with auto-injectors. We're going to cover some more information on adrenaline in a minute. Needle stick injury and biohazard spillage. Needle stick injury SOP is required, and hand hygiene one, which this year more than ever is really, really important. We are still working on a separate SOP to administer for off-site administration of flu vaccination under the NHS Advanced Service. So the current flu PGD SOP that we have made available does not cover off-site administration. We are working on a separate SOP for that, which is going to be available very shortly. And we're just updating the cold chain SOP as well, which will be available very shortly. Alongside it, there's a number of other things, including risk assessment templates and things, but we're going to talk about that in a little bit more detail. So I'll mention that first. But to support your pharmacy teams as well in terms of how to have the discussion about flu and the risks of flu with patients, so they can help patients to understand the importance of having the flu vaccination. There are, the flu fact sheet as well as the flu vaccine information guide for the team and various other resources, including the chaperone policy resources. We've updated all of these resources bearing COVID-19 in mind and the need for infection control and how to ensure that all of these things are implemented in a COVID-secure manner. So the seasonal flu vaccination SOP, this is just what it looks like. You can see the first picture there on the left is about how to prepare for the service. The one on the right is preparing, and the one at the bottom is an appendix we have in the SOP, which is like a decision-making flow chart to help you in terms of deciding which vaccine to administer in which age group. Because as you know from the PGD, there are different vaccine recommendations for those aged 65 years and over, and those aged between 18 to 64 to under 65 years of age. So that is summarizing what the PGD states in there in a useful flow chart to help you. We've also provided a flu training pathway as a document. So this is to ensure, because there has been some changed and updated guidance this year in terms of what sort of training to undertake. This is again a flow chart to help you determine whether you're ready to deliver the service now. So, and on the right-hand side, we provided a template to support you in pre-screening your patients to ensure that you try to do as many checks as possible before the patient comes to the pharmacy to receive their flu jab. Infection control, as you know, there is specific COVID-19 guidance in terms of the risk from COVID. And if it is not possible to screen patients or indeed your customers just as a general rule of thumb and not necessarily under the flu vaccine service or any vaccination services, even just patients and customers coming to your pharmacy, it is advisable to ensure that the infection control processes are in place as a general requirement, as well as proper signs around the premises and at the door, advising of necessary precautions like telling people, please don't enter here if you're displaying any symptoms of COVID, as well as maintaining the 2-meter social distancing, using floor marking, screens, etc. Now, we talked about the key requirements earlier, and risk management this year, more than any previous year, has been really put a spotlight upon, really. So risk management is really important. We covered this in detail in our first flu webinar, as well as our recent NPA conference webinar on individual risk assessment. So there is plenty of information available there already. I would strongly recommend doing 3 different risk assessments. The workplace one is a mandatory requirement under health and safety, which you would have done already. Individual risk assessment is also something that's been required by NHS England and Improvement recently, and we have provided a vaccination services specific risk assessment tool, particularly to support delivery of the vaccination services, including the flu service. So the process is do the assessment, identify the risk, take actions to mitigate that risk, and review again to keep everybody safe as this season progresses. So these are the contents of the workplace risk assessment. As you can see, it covers many different areas, including how to manage customers, patients, visitors, PPE, social distancing, everything. There is also included in there a little guide on the left here about the do's and don'ts of preventing infection, as well as a hand hygiene SOP is included in there as well as available separately, all updated with COVID in mind. The individual risk assessment pack, which we've discussed in previous webinars, covers a number of key resources in there to undertake a thorough risk assessment on an individual basis. So you may want to strongly consider doing this, for example, for your pharmacists who are going to be delivering the flu service, so that their precautions are tailored to them in particular, taking into account their particular risk factors. The vaccination services risk assessment, which really adds to this flu vaccination service, is specific. We have looked at it from a patient perspective as well as from your vaccinator perspective as well, and it covers a number of different elements of it. Yes, I agree. When you look at this, you will notice that there is a certain element of overlap, and that is out of necessity. Some of the key considerations remain, but they're tailored to the type of assessment you're trying to do. The PPE recommendations, have changed. You will probably know that there has been periodic change about the guidance from PHE over the last few months. So the key message at the moment is that any pharmacists administering the flu vaccines or injections must apply hand hygiene between patients and wear a sessional type 2R mask. Now, this goes back to my point about the individual risk assessment as well, because an individual risk assessment will show you whether there is a requirement for further PPE measures for the individual pharmacist undertaking this service, to take into account also the location where they are providing the service, within the consultation room or outside the consultation room, the size of your consultation room, what cleaning and hygiene measures are put in place, as the pharmacists themselves have any particular clinical risk factors themselves. It puts them at added risk added vulnerability to infections or COVID indeed. So this is why it's really important to do the risk assessments all together and take a holistic approach to this. With regards to the safe use of consultation rooms, where if you've determined that you have your consultation room sort of lends itself to you being able to provide your service from the consultation room itself, you're able to implement the various COVID measures, safety measures, etc. There are some key considerations for the use of consultation rooms which need to be borne in mind. And the NPA, as a medication safety officer's role, is part of the community pharmacy patient safety group of MSOs, which covers all of the sector in England. And we have worked as part of that group to, and the group has published a safe use of consultation rooms resource, which is available to download from the pharmacy safety website. And that really also helps support the service delivery in line with the vaccination services risk assessment as well. Thank you. Sorry, just needed a drink of water. I've been speaking for quite some time now. Right, moving on. So let's look at anaphylaxis in a little bit of detail. Chapter 8 of the Green Book for Immunization covers information on anaphylaxis. Now, anaphylaxis itself, as you probably know from having vaccinated in previous years, itself is extremely rare. However, it has the potential to be fatal. Therefore, it's really, really important that it's managed, identified, and managed really quickly, and that you're trained to do so. And looking at the statistics, you may know that between 1997 to 2003, and I know it's going back a few years now, but this is what's quoted in the Green Book, there were a total of 130 reports of anaphylaxis to the MHRA related to vaccines, which equates to approximately 1 report per million vaccine doses delivered. So you can see that anaphylaxis itself appears to be quite rare. However, as you know, it is quite serious. Now, one of the questions we are being asked repeatedly is, especially with COVID-19 in mind, is how long after you administer a vaccine to somebody do you have to sit there and observe them for? And the advice is that in reality there is no specific time frame mentioned, because the onset of it can be quite rapid, typically within minutes, but it clinically can present itself as quite unpredictable. But also, I've heard of cases where it didn't manifest itself quite quickly, but it can happen hours later as well. So the idea is to be trained in it and observe, but there is no time frame stipulated. So as it clearly states in the Green Book, it's not possible to define a particular time period over which individuals should be observed following immunization to ensure that they do not develop anaphylaxis. So I would advise that the best thing to do is to follow the guidance and the advice you've been given as part of your vaccination training, which will have covered anaphylaxis in there. And the questions we often get asked as well is what should be included in an anaphylaxis pack? So again, the Chapter 8 of the Green Book covers this, and I'm mentioning that because there is signposting from the PGD itself to the relevant sections in the Green Book. So the pack would normally contain 2 ampoules of adrenaline 1 in 1,000, 4 23-gauge needles, 4 graduated 1 syringes, and Ladidel or equivalent mask suitable for children and adults. Now, the question we have repeatedly every single year is, can we use an auto-injector to administer adrenaline in an emergency? And the answer is that in an emergency, you can use adrenaline available in whichever form is available in your pharmacy. Although auto-injectors are generally for self-administration, if that's the only form of adrenaline available in the pharmacy, then yes, use it. That's the simple answer. However, it would be prudent to also be mindful of adrenaline in the ampoules format and have a process in place, and the NPA training covers administration from an ampule as well for that. And here's our SOP, which covers administration from an ampule as well as from auto-injectors, updated with COVID guidance. So just coming up to some member FAQs. We are nearly at the halfway mark, and thank you for persevering with us. I've had a question come through the Q&As about the under 50-year-olds, and I'm going to cover that in our FAQs in a minute, so please bear with me. So as I mentioned at the beginning, a lot of questions coming around written consent. So as I mentioned before, the need for written consent has been removed. However, consent must be obtained. So the PGD service requires that the patients are provided with enough information to ensure that the consent you receive is valid. So it covers off the criteria for consent. And also, the main thing is because if you don't get the written consent, you do need to document that to ensure that, yes, you have received consent for the service before you provide the service. So it can be verbal, it can be recorded in the pharmacist clinical record, and signed consent record is no longer mandatory. So please bear that in mind. Key question this year has been about professional indemnity, and we do have the question raised every year, but this year more than before, it is particularly important also from a COVID perspective. So NPA members will already know this, and if you haven't come across this before, I will just quickly show you this slide, which is the NPA professional indemnity statement. The point I would like to make on this point is that the professional indemnity cover available for members to provide PGD vaccination services covers both private and or NHS PGD vaccination services, which includes flu in there. And you are covered to provide this service both from the registered pharmacy premises, whether it's in the consultation room or outside, doesn't matter, as well as from off-site locations, providing that all the PGD and service requirements are fulfilled correctly. So you can see, because we've been asked this repeatedly to say that if I'm providing this from an off-site location, will it cover me? And yes, be assured it is, because the key point here is that the professional indemnity covers the activity of vaccinating a patient. So this is not specific to what the actual requirements are under the service specification or the PGD. So the indemnity is not tailored for that. The indemnity covers the activity of vaccinating somebody, and you're indemnified for that, providing that you follow the relevant PGD requirements and the service requirements correctly. You're trained appropriately, and you're confident and competent to offer that service. And during the COVID-19 pandemic, obviously one of the imperative requirements is that employees and patients are protected against COVID-19. So a risk assessment must be completed prior to reintroducing or providing vaccination services in the pharmacy. Thank you. I just want to thank some comments coming from one of our members who's assuring us that, yes, and you're absolutely correct there, that anaphylaxis is covered in detail as part of the training. It is a prerequisite. So you may have been surprised for me to cover it in quite so much detail today. However, I felt it important, given some of the questions that we've been asked recently, to re-highlight some of the key points from that. So that's the reason for that. Thank you. As you know, the payment for the flu vaccination service has only just been announced in the last couple of days. And you will notice that the fee for vaccination remains the same as last year at $9.58. You have an additional 50 pence per vaccination, which will be paid, which is separately coming from the transition fund. And community pharmacy as a sector has been allowed to up to £1 million of medicines margin to be retained, in addition to the allowed £800 million. So this is obviously announced by the PSNC, and please make yourself familiar with that. Furthermore, you also get reimbursed for the cost of the vaccine, which is the basic list price for the vaccine, and at the applicable rate of VAT as well. So that's just briefly mentioning that because of the number of questions we've had on this recently. This is gaining some momentum in terms of there's also some additional funding announced by the PSNC recently for off-site provision of the service. And the intention is to support the cost of venue hire and cold storage costs incurred. So I just wanted to point out here that before you do this, you are required to obtain pre-authorization from your local regional NHS England Improvement team. To do that, there is some guidance, and the final process for that is still being finalized. And once it's ready, it will be actually cascaded down to contractors, either via your LPC or directly even through your mailbox. So please do hold on for that. The cost, what you can claim for funding is for the first time venue hire claim. When you put the first claim in, you can additionally claim a one-off payment of £200 for cold storage equipment. For the venue hire itself, you can claim £200 as well. However, if your venue hire is costing less than £200, please only put in the actual cost that you incurred. And you're allowed to submit up to 5 claims for the venue hire. Remember, that doesn't include cold storage equipment every single time. The 5 claims is for venue hire only. And pre-authorization will be given on a first-come, first-served basis from a finite budget. So if you do have any further questions on this, you may wish to get in touch with your LPC regarding that. So I mentioned earlier that our community pharmacy advanced service flu PGD SOP in the appendix gives you a flow chart, which is a vaccine decision-making flow chart. And we've had a number of different questions presented to us about the confusion over which vaccine to provide under this service. So I just wanted to highlight what we picked out, and more importantly, what I would like to highlight to it is that in the last couple of days alone, only Public Health England has published extensive detailed guidance on inactivated influenza vaccination by healthcare professionals. That information can be used over and above what's in the service specification and the flu PGD because it gives a lot of further information in detail. So the PGD states what I've included in my little table here, that 18 years to under 65 offer the QIVC or QIVE as an alternative to the QIVC. Now, we've had a number of questions raised about that, saying the way it's written, it reads like, are we saying the QIVC is an alternative to QIVC? But that is certainly not the point. The recommendation is basically offer the QIVC, which is a cell-based quadrivalent influenza vaccine. If it's not suitable, then as an alternative, you can offer them the QIVE, which is the egg-grown quadrivalent influenza vaccine, as an alternative to the QIVC. So I hope that clarifies that for you. And in those aged 65 and over, offer the adjuvanted trivalent influenza vaccine, the ATIV vaccine. Now, this next point, which I've listed here under the PHE guidance, says that a cell-based quadrivalent influenza vaccine, QIVC, can be offered to those aged 65 years and over if ATIV is not available. Now, we've had a number of questions on this to say, okay, what does it mean by not available? So we are at the beginning of the flu season at the moment. We've been made aware that not everybody has received their flu vaccine delivery yet. So the question is, what does it mean by if not available is not defined? So I would say, what would you consider giving to a patient if you have ordered the ATIV as well as the QIVC, and you haven't received your vaccine delivery yet, but you're expecting it in the next few days? So in those circumstances, would it be appropriate to give the patient the QIVC, knowing that the first recommendation is ATIV, which is going to be available in the next few days? So I think it's a matter of professional judgment to ensure that the correct age group is offered the vaccine, which is the first recommendation available, and not necessarily directly go to the alternative. Please consider the circumstances. because there is a reason as to why the ATIV has been particularly recommended in the 65 and over age group in terms of how it works in that age group. So it is really important because the current available evidence indicates that there's additional benefit from ATIV vaccine in those age 65 years and over compared to the standard dose egg-cultured inactivated trivalent or quadrivalent vaccines. So those additional benefits that those age 65 years and over obtain from the ATIV vaccine is an important clinical factor to consider in there. So I hope that that's clarified that for you. Sorry, just to go back to my previous slide, I would say please do read the service specification and the PGD in detail again. So this is what the vaccine decision-making flowchart looks like in the flu flu service SOP. So you may wish to use that to help you to reach a decision. We've already had a couple of queries where the wrong vaccine has been inadvertently administered to the wrong age group, and how this needs to be managed. So if you recall a couple of minutes ago, I mentioned the Public Health England guidance, which has been issued in the last couple of days on inactivated influenza vaccination for healthcare practitioners. That covers some quite good information and guidance regarding what to do where the wrong vaccine has been inadvertently administered to the patient, to the wrong age group, basically. So the first thing is, obviously, the patient would need to be informed of the error and the potential implications of this. So that means being able to explain to the patient the difference between the vaccine that they received compared to the one that they should have received, as well as any of the clinical benefits associated with what the correct vaccine would bring them. If they say that, yes, I would like to have the correct vaccine, then this can be offered to them. Obviously, once you've discussed the risks and benefits of that and they're happy for that. If a decision is made to offer the vaccine, the correct vaccine, it is recommended it's done as soon as possible after the first dose is given, and ideally within the same week. However, it can still be given if more than a week has elapsed. But again, please read the flu PGD and the service specification and the guidance from Public Health England, where this is talked about in more detail. So I had a question submitted through the Q&As about, can we vaccinate those aged 50 to 64 years of age? Actually, the question was, what about the under 50-year-olds? Do they qualify? So I would just like to point out that if I go back to the beginning of my presentation where we looked at the inclusion criteria, if I can click there, any patient, any individual who's aged 18 years and above to under 65 years of age can only be vaccinated under this advanced service if they fall in one of the clinical risk groups that are listed on the left-hand side of this slide. And where a more fuller detailed list is available in Annex A of the service specification. So the bottom line is, if your patient is aged 65 years or over, yes, they can be vaccinated under this flu PGD service. That's it. If, however, they are under 65 years of age and 18 years and over, they can only be included in this PGD and provided with the flu jab if they meet the clinical criteria or the other enhanced criteria, which is listed on the right-hand side. The full inclusion criteria is given and explained in great detail in the actual flu PGD itself. So I hope that covers the question about the under 50s, vaccinating those under 50. Just going back to where I was to pick up from there. Thank you. So the question that has come up frequently is, what about those aged between 50 to 64 years of age? Because you will recall that this has been something that has been talked about. So just want to be very clear that currently, as it stands at the moment, individuals aged between 50 to 64 years old cannot be vaccinated under this flu PGD unless they meet one of the inclusion criteria that I just mentioned a minute ago. If they don't meet the inclusion criteria, either clinical risk group or the expanded cohort, then they cannot be vaccinated under the flu PGD at the moment. Now, this may change later on in the flu season, but we have to wait for an announcement to be made, first of all, before they can be vaccinated. Prior to any such announcement, and I'm referring to my bullet point 4 here in red, patients aged 50 to 64 who are not in one of the clinical at-risk groups, basically those who don't meet eligibility criteria, are not eligible to be vaccinated under this service. And if you do so, then this will be acting outside of the PGD criteria, and you will not be able to claim payment for those vaccinations. So when you look at the flu PGD for this year, this is exactly what it states in the flu PGD. It currently states that in the 2021 thing, it says it may be extended, and you will notice that there is an entire list here of each individual age group on a year-by-year basis. And the reason it's been listed like that in the PGD is because when an announcement is made, it may not necessarily cover all of the age, individual age years between 50 to 64. It may cover one year group or more than year group at a time. So at the moment, unless they meet the eligibility criteria, 50 to 64-year-olds cannot be automatically vaccinated under this PGD. I hope that that's clarified for that. Right. This is a perennial question. Can the pregnant women be vaccinated under the PGD? Yes, the flu PGD includes pregnant women as an inclusion criteria. Again, there is studies and evidence to say that, yes, they can receive the vaccine. And actually, indeed, if they catch influenza during pregnancy, there is a higher risk of perinatal mortality, prematurity, low birth weight, etc. So, yes, they are one of the eligible groups under the PGD. The question then goes on to whether breastfeeding women can be vaccinated under this flu PGD. However, please note that breastfeeding itself is not a clinical indication for influenza vaccination. So breastfeeding women would not be able to have a flu jab under the NHS under this PGD unless if they are also pregnant at the same time or in a clinical risk group. Please do have a look at the PGD again. So one of the questions which has been asked as well is, if you have a patient who has recently recovered from COVID-19, can you vaccinate them? So, well, the answer is, if a patient is eligible to receive an NHS-funded flu vaccine under this PGD, i.e. they meet the inclusion criteria, they can receive this flu vaccination. However, obviously, if they're self-isolating, they need to wait until they finish their period of self-isolation before they come to the pharmacy or, before you have contact with them to vaccinate them. Or indeed, if, they need to have recovered from their illness, basically. This has become a very, very strongly asked question in the last 2-3 days in particular about vaccinating patients on anticoagulants or with bleeding disorders. So actually the PGD does cover this in quite a bit of detail, and the important thing to note here is that those who are on stable anticoagulation therapy can receive the intramuscular vaccination, basically, and it then goes into detail about the needle size to use, etc. So the thing to look at is does the patient in front of you demonstrate, or do they have stable anticoagulation therapy? So, for example, if the patient has undergoing multiple dose changes and you're aware of that happening around about the time, then that would not probably be considered stable anticoagulation therapy. So you would need to take that into consideration, basically. So this has become a hot topic recently. We've had a number of our members saying that they're being requested by staff from their local GP practice asking if they can come to the pharmacy for a flu jab. We're not quite sure of the reasons for that. Is whether there is no provision for them to receive it anywhere else? Not quite sure. However, a GP staff would not be able to be vaccinated under the NHS flu service unless they fall under an eligible patient group under this PGD. If they're eligible, clinically eligible, yes, they can be covered. If not, they need to be referred back to the practice for them to be vaccinated as part of the practice's occupational health arrangements. If you have a member of the pharmacy team or any members of your pharmacy team who fall within the eligibility or the inclusion criteria, they would be able to use the service. Otherwise, they would have to be vaccinated either as part of occupational health arrangements or actually with both circumstances, if you are offering a private flu vaccination service alongside this, you can check whether that's eligible, and then it can be offered potentially. Record keeping is very, very important, and the PGD criteria lists the exact records that need to be kept. This is on page 13 of the flu PGD, and it needs to be adhered to. Furthermore, there is also a requirement under the flu PGD for patient safety and reporting about what to do about adverse reaction reporting to vaccines, etc. Now, most of the QIVC and QIVE vaccines for this year are black triangle items, which means that they're newly licensed vaccines. And, they will have an inverted black triangle displayed on their packaging, basically. So any suspected adverse reaction to these products should be reported through the yellow card scheme, please. I mentioned earlier in the webinar about vaccine incidence management. So in January this year, January 2020, Public Health England issued an updated vaccine incident guidance about how to respond or manage errors in vaccine storage, handling, or administration. It's a very, very detailed 60-plus page guide, but it does cover a number of scenarios in practice, and this is one of also the signposted reading in terms of preparing to deliver the flu service as part of the PGD itself. So that's something you could have a look at as well, and there is a link to it from the PGD itself about what to do in managing that error. Many of our members this year, more than any other previous year, are seeking to provide a service in a managed way through an appointment booking system, and it depends on what your processes are and how you decided to deliver the service this year to see whether you have the capacity to do it on a walk-in basis or indeed it's safer, maybe a little bit safer to do it as a pre-book thing where you are able to pre-screen your patients. The NPA does have a business partner available who has a appointment booking system available that you may wish to seek to use if you wanted to, and it's through TravelJab. So before I move on to my next bit, we're nearly coming up to the closing time, but I'm just having a look at the number of questions which have been submitted, and is showing huge interest in there, so that's really good. So if I can just pick up a few of that, I apologize in advance because I will not be able to cover every single question submitted, and there's a fair number of them here. So what we will do is we'll take away all the other questions I'm not able to cover, and indeed even the ones I'm able to cover, and we will draft up some answers to them and load them up on the website in a week or two's time as soon as we're able to get them ready. So if I can pick up quickly, the one under the 50-year-old criteria I've covered off completely, so I think that's been done. Yes, so the question has come in to say, do we need to inform each patient's GP that the patient has been vaccinated? Yes, this is covered in the flu PGD itself. It is a requirement to notify the patient's GP, so I hope that helps. So the question also has arisen about the claim for off-site delivery. So I would say that the question is, can you claim for cold storage without a venue hire? So the current information that's available says that you can claim for the cold storage equipment the first time you submit a claim for venue hire. Now, we are awaiting some further additional detail and guidance on that imminently from NHS England. So I suggest holding on for that, because the way we're interpreting it at the moment, you cannot claim for only the cold storage equipment is the way I'm reading it. However, that is one of the areas where we are seeking further clarity on. And a question to say about providing the flu vaccination service and about closing the pharmacy. So you may be aware that PSNC has already advised in their guidance issued earlier this month that they're seeking flexibility to see whether the pharmacy can provide a focused flu clinic as part of their operating hours. So currently, you're not able to just do a flu clinic and nothing else, because the NHS terms of service require that pharmaceutical services, all the pharmaceutical services are available to patients during their hours of operation. So that is being sought as a flexibility by PSNC. That hasn't been permitted yet, but it's an ongoing conversation, and they're seeking that flexibility from NHS England. The question is about keeping records electronically. So yes, you may be using the Sonar platform for recording everything if you're in the London region. You may be using Pharma Outcomes if you're outside of the London region. And yes, the records can be kept electronically. I would say it is also advisable as a precaution where you're seeking verbal consent to record it potentially on the patient's PMI. You may want to consider that as well, but it does need to be recorded in the patient's clinical record nevertheless anyway. The question has come in about any extra paperwork or precautions if you offer private vaccines. So could I just make this very, very clear? The NHS PGD covers, and the service specification covers all the service requirements required to provide the service under the NHS as an NHS-funded service where you get paid by the NHS to provide the flu jabs to eligible patients. If you are operating separately a private flu PGD service, then you must completely keep it completely separate from the NHS service. So, for example, the same PGD legislation regulatory requirements apply to private PGDs as well, which means that to operate a private PGD, the pharmacist operating that particular private PGD would have to be named and authorized to operate that PGD itself. They would have to follow the inclusion and exclusion criteria for the relevant PGD that you're using. And obviously, you can't just use the same PGD and say, I will use this for the private. It doesn't work that way. Every single PGD that you operate is a standalone legal document and a legal authority, and the service can only be provided under the terms of that individual PGD. If you're providing a private flu PGD service, you need to make sure you're following the terms and the requirement and the criteria of that particular private PGD then. So I hope that that covers that off. So just to reiterate my point, Pharma Outcomes platform is usually available to contractors outside of the London area. Within the London region, the platform available is usually Sonar. But you can certainly check if you're already using the Pharma Outcomes platform, you can certainly check on that. But our understanding is that the two platforms operate on that basis. And the question is about if a patient does not want to come into the pharmacy, could you go out to their car to vaccinate? Well, I would say that that falls under what would be considered an off-site way, an off-site vaccination. So it's up to you. It depends on your risk assessment. It depends on the process you are going to put in place. Where is the car going to be? What other considerations are you giving them? And thinking it through as to how it would work, where is that car going to be parked, right outside, down the road, etc. There's a number of different factors. So we are, as I mentioned earlier in the webinar, we are looking at a SOP or standard operating procedure template for members to take into to sort of include some of the considerations which are required for off-site vaccination delivery. So because off-site vaccinations are permitted, it would be up to you how you actually implement it depending on how this whole process is going to set up. And you know, when you go out there, you're leaving the pharmacy premises, so you would have to have a process in place for off-site vaccinations. Again, there is a question coming about patients aged 50 to 64 years of age with no inclusion, who do not meet the inclusion criteria. So here's where you have an option. If you have a patient who is aged 50 to 64 years of age and they do not meet the inclusion criteria for the NHS flu PGD service under the community pharmacy, then you have a number of options. So number one option is you may decide that they can be referred to the GP practice to see whether, but again, you all know what the clinical criteria is. This has been published in the flu letters. If they don't match the inclusion criteria, they can be offered a private flu PGD service, a private flu jab, basically, if your pharmacy and you as a pharmacist are actually also offering and operating a private flu PGD, which means you've signed up and you're authorized under a private flu PGD to offer it on a private basis. But it's a choice you can offer those patients who don't meet the NHS eligibility criteria. Excuse me. A question has arisen as to is the pharmacist's signature necessary on the flu PGD? If you look at Section 7 of the NHS flu PGD, yes, I mean, it needs to be authorized. There's a practitioner authorization sheet in here, which requires the individual pharmacists who are going to be operating the PGD in that pharmacy to actually sign and confirm that and put that in, and an authorizing manager to sign it on that page, which is page 16 out of 18 in the pharmacy flu PGD, before that service can be offered. So yes, the pharmacist would have to read, put their name in there, their designation, their signature, and the date, and then have the authorizing manager sign it off at the bottom before they can operate that flu PGD. So I hope that helps. So that covers. So a question has just come in, just as we're coming to the end, about NPA insurance again, and does it cover a private PGD? So I'm going to go back to my FAQ, which I covered here already, about NPA professional indemnity, where, as I mentioned earlier, yes, NPA professional indemnity insurance covers members to provide PGD vaccination services, which can be flu, pneumococcal, travel vaccinations, any PGD vaccination service on a private basis or under the NHS, both from the registered pharmacy premises as well as off-site. You are covered for the activity of vaccinating under those circumstances, providing that you meet all of the requirements under the PGD and the service. So I hope that answers the question about does NPA insurance cover a private PGD. So I think there's more questions coming in still, and unfortunately we are running out of time this evening. I do hope that you found it useful. There are a number of still additional questions and a number of other areas of this service which we've not had a chance to touch upon this evening. So we may be considering doing another flu webinar in just a very few short weeks again. So if you are interested, please do email events@npa.co.uk. All of the flu service SOPs and resources and all the other NPA resources I mentioned are available to access through our NPA's dedicated NHS flu service page, which I'll put up the URL there. If you do have any questions or any queries at all, please do contact my team, which is the advice and support team, and we are open Monday to Friday, 9 to 6, and Saturday, 9 to 1, or email us at pharmacyservices@npa.co.uk, and we will support you in the best way we can. Thank you for listening, everyone. I do appreciate your time this evening. Wishing you all the success in delivering this flu service quite successfully and in a very COVID-safe manner. And thank you for listening. Good night.